Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about a common pain medication, if you will, used for chronic low back pain. I'll certainly give you my opinion about how well it works and how often it's used. But the problem is that this drug might not be as benign as we think that it is, and with the scaring off of opioids, doctors have been scrambling to try to find something to replace it, and gabapentin kind of fell into that loop. So before before I go into this study, make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel. So that being said, gabapentin, which used to be the brand name Neurontin, has been around for a long time. Gosh, technically it's only approved for seizures, so it's an anti-seizure drug. That's how it started. Post-herpetic neuralgia, so you've got shingles and now you've got nerve pain as a result of that, and restless leg syndrome, RLS. Those are the only three things it's approved for, and yet its off-label use is remarkably massive. Years ago, it seemed like every other person was coming in with a Neurontin prescription, all of them off-label, and ultimately, as a result of that promotion of off-label, the pharmaceutical company that Neurontin, I think it was Merck, was fined $430 million, like one of the top 10 largest fines ever for a pharmaceutical company. Paled in comparison to the billions that they made, but so this was a study where it's used for chronic low back pain. And again, off-label use, and quite frankly, it kind of sucks for use of chronic low back pain, especially axial, where it's just the back. I don't even know why people come in with prescriptions for that, because it doesn't really seem to do anything. But it's done, it's written, and there's a lot of people taking that. So in this study, they looked at 52,000 adults and followed them for 10 years. And these were general 35 to 64 years of age. And they looked at cognition and risk of dementia. And what they found is, over the course of 10 years, that the more prescriptions somebody had, so if somebody ended up having 6 or more prescriptions, then their risk of dementia went up 29%. For cognitive loss, it was 85%. Like, that's a pretty big jump, especially considering that cognitive decline and dementia are a big issue in society, largely because it's lifestyle driven. I've certainly covered that enough. But so here's the deal. Like, does it mean that gabapentin is messing with something in the brain? There's some people that think because it messes with the dopamine pathways that yes, it might have a direct effect on brain and cognition. Or it could just be that people with chronic low back pain are generally, we've got underlying inflammation, have a tendency to be more sedentary, and those absolutely contribute to dementia and cognitive issues down the line. So the reality is, like, it just doesn't really work that well for low back pain, at least not that I've seen with my patients. Otherwise, I wouldn't be seeing them because they probably feel better, and it just never seems to happen. If they've got leg pain or arm pain, might have a different discussion, but for axial back pain, really doesn't seem to be that effective. And then the fact that there are risks on top of it just makes this a questionable community process in medicine. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.